My name is Lena Hall. I'm a family nurse practitioner student, and today I'll be doing an abdominal examination. Do I have your consent?
Yes.
Okay, so I'm first going to start with looking at the patient's abdomen and inspecting the first symmetry, any sort of masses, looking for discoloration, looking at the contour. The contour is flat, no concave. There's no scarring of the skin, no stray, no rashes, no lesions, no dilated veins. And I'm looking at the on the umbilicus, and it's not inflamed. There's no bulges. There's no peristalsis or aortic pulsations observed. So next we will be performing the auscultations, because you perform the auscultations before you perform the percussion or palpitations. So we're going to be listening to the vowel sounds in all four quadrants. When I'm listening to this, I will be noting frequency and character. Okay. Vowel sounds were heard in all four quadrants. They're not hyperactive or hypoactive. They are consistent, and I can hear them. Next, we're going to listen to the bruits in the aorta and the renal and the iliac and the femoral arteries. So first, we're going to start with the aorta. Okay. Okay. No bruits heard in the aorta or in the renal. Now I'm moving to the iliac. No bruits heard in the iliac, and I'll be listening in the femoral artery. Okay. No bruits heard in the femoral artery. Also no venous hums or friction rubs were listened over the liver and the spleen. Next, we're going to be moving to percussion, and I'm going to be percussing in all 9 of the quadrants. Okay. Next, I'm going to measure the span of the liver dullness at the right midclavicular line is where you would start, and you percuss downward, starting just under the breasts, and you percuss until you hear the dullness is heard, and then you start from percuss from the level of the umbilicus, and you move upward until the dullness is heard again, and then you measure it. So okay. So from about there to there, that's about 5 centimeters. Next, we're going to assess for splenomegaly. So for this, you're going to percuss at the anterior line of the lowest interspace and ask the patient to take a deep breath. Okay. No pain was felt, or no spleen, no wincing of the face was observed, so that the spleen is not enlarged, or there's no splenomegaly observed. Now we're going to palpate. So I'm going to have the patient bring their knees up. So their knees are bent, head is supported, and arms are at side. So I'm going to do a light palpation for tenderness and guarding or superficial masses in all 9 quadrants. So light palpation. No wincing observed, no masses felt. Any pain?
No.
Okay. Next, we're going to do a deep palpation for tenderness and masses, and that means we're going to go much deeper and we're going to depress the skin about 2 to 3 inches. Any pain?
No.
Okay. Now there was no pain, no tenderness felt, no masses felt. Patients, no squirming or facial expressions stated that there was any pain felt. So next we're going to palpate for rebound tenderness. To assess for this, this is for peritoneal inflammation. You're going to press down slowly in the area of tenderness and quickly release. So I'm going to do it in all 4 quadrants. Any pain?
No. No.
All right, now I'm going to palpate the liver edge, the spleen, and the kidneys for enlargement. So for the liver, I'm going to place my hand underneath, and then I'm going to palpate between and press up towards the ceiling with my fingers underneath, and then I'm going to palpate upward, not in a scooping fashion. If the patient was obese, then I would press them and would push with a scooping, but I'm just going to press with my hand, and I can feel the edge of the patient's liver. I would start from the level of the umbilicus and would continue until I'm about the lower of the left rib, which the right rib. So that would be where the liver's edge would be. And I'm going to ask you to take a deep breath. And then I can feel the liver edge as it moves under my fingertips. Now I'm going to reach over and use my left hand to press the left lower rib cage upward. And then I'm going to feel with my right hand. Take a deep breath. And I can feel the patient's spleen edge. Okay, and now I'm going to feel for the kidneys. I don't feel the kidneys, I don't feel the liver or the spleen enlarged. And now I'm going to feel for the aortic width. And the aortic is not enlarged. Okay, next I'm going to have the patient sit up and turn his back towards the camera and lift your shirt out for me, and I'm going to assess the patient for the costovertebral angle or CVA tenderness. So I'm going to place my hand there and I'm going to make a fist. Did you feel any pain?
No.
Any pain?
No.
Okay, so that's a negative test. Go ahead and lie back for me. Next, we're going to test for ascites, and I'm going to lift the patient's shirt up, and then I'm going to percuss on the side until I hear dullness, and then I'm going to have the patient roll over on their side, and then I'm going to percuss again until I feel the same spot, until I feel the dullness again. Ready? Okay, right there. So go ahead and roll over on your side. Roll over on your side. Okay, and it's the same side. So now I'm going to have the patient assist me and put his hands like this And I'm going to place both hands on this side, and I'm going to tap on one side, and I do not feel it on the other side, so it is negative for ascites. Next, I'm going to assess the patient for appendicitis using the Rosen sign, left-sided pain. So the patient right-sided pain during left-sided pressure. So I'm going to press on the right side, and you're going to tell me if you're feeling any pain on the left side, okay?
Okay.
You feeling any pain?
No.
Okay. Next, I'm going to test for poesis sign. So I'm going to push on the patient's leg, and they're going to bring this right leg up. Okay. Do you feel any pain in the right side?
No.
Left side? Okay. Go ahead and put your leg down. And next, I'm going to do the abturator sign. So I'm going to have you would have pain with the right hip flexation and internal rotation. So I'm going to go ahead and have the patient lift their leg up. An internal rotation. Do you feel any pain?
No.
All right. And next, that was negative. The patient does not have appendicitis. Next, I'm going to assess for cholecystitis and assess for Murphy sign by palpating the liver edge and asking the patient to take a deep breath. And I'm going to watch for sharp pain, and that stops with inspiration. Take some deep breaths for me. Any pain?
No.
Okay. The patient is negative for cholecystitis. And that is my assessment for abdominal examination.